So now we will be discussing anatomy before and after the critical period. Phonation is the production of sounds by means of vocal fold vibrations. Vocal folds convert aerodynamic energy into acoustic energy. Pitch, loudness, and quality is what we perceive. So children and adults tend to produce sounds in similar manners. Um, and then here is just a comparison of the vocal fold size in children and adults. Now here we see a picture of the adult and child upper airway. The tongue is larger in proportion to the mouth within a child. So now this creates more constriction and higher formant frequencies. So we perceive those frequencies in a higher pitched voice in children. The pharynx is smaller. The pharynx is one of the resonators. So the air within the pharynx gets manipulated and modified differently than within an adult. The epiglottis is larger and floppier. The larynx is more anterior and superior. And the cricoid as well as the trachea are more narrow, and the trachea is less rigid within a child. Code switching versus code mixing. Code switching is when a person uses two or more languages, typically within the same discourse, while code mixing is when a child mixes two or more languages within the same discourse, usually not on purpose. Code switching occurs more fluently after the critical period, while code mixing occurs more in premature language learners before a critical period. The main difference between code switching and code mixing is the intent. People who use code switching typically understand that their listener understands both languages, while code mixing, again, is premature. The child usually is learning the language simultaneously, so they will mix the two languages using it properly, but not quite grasping that the listener may not understand both languages. So why does code switching happen, and why is it important to SLPs? Code switching, again, is matured language ability, while code mixing is premature language ability. So code switching is purposeful, useful, and facilitates communication, while code mixing usually disappears on its own and is a short-lived phase within children. SLPs can assist children with the manipulation of language according to the listener. So again, code switching is not appropriate in all situations, again, because not everyone understands those two languages. So if someone is strictly resorting back to code switching because they can't formulate their thoughts appropriately within that one language because it is a language that they're learning, they need to work on strategies to work around it. Now, reasons for code switching include to explain, to clarify, to amplify, and emphasize, and sometimes it's just part of someone's personality and their identity. So clinical implications, applications of therapy, language acquisition of L1 and L2, the languages to which a child is exposed shapes the production and perception of sounds. So if a child is always exposed to certain sounds, they're more inclined to learn them. Infants have the ability to perceive and discriminate differences in speech sounds and are not innately biased towards particular phonemic characteristics of any specific language. So at this point, infants are human sponges, and they take in everything that they hear, and they're able to easily differentiate between these speech sounds of multiple languages. However, that ability goes away as they start to age, and they only pick up and keep those sounds that are most helpful and useful around them, and ones that are more typically used within the household. So after the critical period, language acquisition of a second language is nearly impossible. And again, critical period kind of ends around that puberty age. There's no real cutoff point, but it tends to be around puberty. Syntactic deficits are present, difficulties with pragmatics and problematic semantics. So these are all consequences of learning a second language, especially once that person has already hit that critical period mark. So what does this mean for SLPs, and why is it important to us? So it is important to establish disordered speech from speech differences. That includes accents and dialects. So it is important to to rule out those speech differences as disordered speech, because we don't want to give therapy and treat someone for something that they really don't need. Evaluation performed in both L1 and L2 is important because we need to make sure that that deficit is present in both L1 and L2 to be considered disordered. If it's present in L2, it's typically just, again, difficulty with adjusting to those new rules of L2. We need to be culturally competent. We can't diagnose someone as disordered over their cultural beliefs. We need to make sure that we are aware of proximity, turn taking, eye contact, and things such as that to make sure that we're not diagnosing them with something that perhaps they don't have and it's just part of their culture. Figurative language, idioms, and word finding, building lexicon. Those are all areas where we can assist. Figurative language and idioms aren't so clear cut, so therefore the person may have difficulty understanding figurative language and idioms to have some to hold meaning for them. Word finding and building lexicon, that goes back to that code switching. We don't want someone to solely rely on code switching because it won't be helpful for them in every situation. So we need to help them establish those words that they need and that lexicon that they need in order to get those thoughts across. And then translating languages, we need the person learning that second language to make sure that they're able to manipulate the rules of both languages in order to be able to translate languages successfully and get their messages across that they want. And that assists with that translating that they need to get done.